Today I'll be discussing kidney disease, one of the most significant chronic illnesses affecting millions today. Today's presentation is brought to you by Ms. Perla Lozano, Ms. Sandra Flores Pena, Ms. Nena Tonte, and Roy Bernal. This presentation will explore its causes, treatments, mental health impact, and the advocacy roles nurses play in improving outcomes. By the end, you'll understand how evidence-based care and community advocacy together improve health and patient quality life. Before we begin, let's take a look at a few pre-test questions. Number 1, what are the most common causes of chronic kidney disease? Number 2, which medication class has been shown to slow the progression of CKD and reduce cardiac and renal events? Number 3, what is the most common mental health challenge that patients with chronic kidney disease frequently experience? Number 4, what is one important advocacy role nurses play in kidney disease care? Understanding kidney disease. Kidney disease can be acute or chronic. AKI develops suddenly and often from dehydration, infection, or medication toxicity, but is sometimes reversible. CKD is persistent kidney damage or low eGFR for the last 3 months. It develops slowly over months and over years. Because its early stages are usually symptom-free, most individuals and patients are unaware until it is advanced. According to the CDC, CKD affects roughly 1 in 7 adults, making early screening very critical. Both forms strain the cardiovascular system, increasing hospitalizations and mortality. Public health impact. CKD is not just a medical issue, but a public health crisis. It is tightly linked to the epidemics of diabetes and hypertension. CKD is a major public health issue because it is common, often undetected, and costly to manage. Treatment, especially dialysis and transplant care, is extremely costly, with the U.S. spending over $130 billion annually on kidney-related conditions. Monitoring and low-income populations face an even greater risk at reduced access to specialists, which emphasizes the need for nursing advocacy and education at the community level. Pathophysiology overview. Leading causes of CKD are diabetes, hypertension, and glomerulonephritis and cystic diseases. When diabetes or high blood pressure is uncontrolled, it damages the glomeruli, which are the kidney's filtering units. As healthy nephrons die, others work even harder and are overworked, leading to scarring or fibrosis. This gradually declines and impairs the kidney's ability to filter waste, balance electrolytes, and produce hormones. As the disease advances, complications arise, such as anemia, bone demineralization, and cardiovascular strain. Genetic factors such as APOL1 mutations further increase susceptibility in some groups. Standard treatment and approaches. Treatment is stage-based. ACE inhibitors, or ARBs, reduce protein loss and slow progression. Newer drugs like SGLT2 inhibitors have been proven to protect kidney and heart health, even in non-diabetic CKD patients. Lifestyle management, such as diet, exercise, blood sugar control plays an equally vital role. Once kidney function drops below 15%, dialysis or transplantation becomes necessary. Nurses coordinate across specialties and educate patients throughout this entire process. Emerging and innovative therapies. Science is advancing quickly. The medication finerenone is a non-steroidal MRA which reduces inflammation and fibrosis. APOL1 inhibitors like inaxaplin are early examples of precision medicine targeting disease at the genetic level. Researchers are also testing wearable artificial kidneys that filter blood continuously, reducing the dependence of dialysis centers. These innovations bring hope for new improved autonomy and survival among patients with chronic kidney disease. Mental health challenges. Living with CKD can be emotionally draining. Patients face fatigue, dietary restrictions, and financial stress. Depression affects up to 1/3 of CKD patients and worsens outcomes if untreated. Recognizing treatment, fatigue, and social stressors is critical to sustaining engagement in care. Anxiety about dialysis, transplant waitlist, or mortality is also frequent. Nurses should screen for depression using validated tools like the PHQ-9 and provide reassurances, empathy, and referrals to counseling when needed. Coping and supporting strategies. Integrating mental health into kidney care improves overall well-being. Cognitive behavioral therapy and motivational interviewing helps patients manage stress and build resilience. Encouraging family and peer involvement, such as support groups through the National Kidney Foundation, fosters community and shared coping. We should also address transportation, food security, and caregiving needs which helps in adherence. Nurses should approach each patient holistically, addressing emotional and social needs as well as physical symptoms. Nursing role and advocacy. Nurses are central to both prevention and advocacy. Early education about controlling blood pressure, maintaining a healthy diet, and screening for microalbuminuria can delay CKD onset. Advocacy means ensuring all patients, regardless of income or race, have equal access to dialysis, transplant evaluation, and medications. Partnering with community organizations like the National Kidney Foundation amplifies outreach and patient empowerment. Nursing in action. Here's a quick example. A nurse is caring for a 56-year-old patient with type 2 diabetes. So let's take a look at our 56-year-old patient as an example. They are type 2 diabetic, they have hypertension, stage 3 CKD, and depressive symptoms. The interventions would be to first educate about adhering to a low sodium diet, followed by teaching the patient about blood pressure, 3, glucose monitoring, and 4, medication adherence, and to do a depression screening using our PHQ-9 tool. By doing so, the nurses help slow the disease progression and improve mental well-being, demonstrating an impact of holistic nursing care. Let's take a look at a few takeaways from today's presentation. To summarize, kidney disease is preventable and manageable when detected early. Nurses can influence the outcomes through education, empathy, and advocacy. As treatments evolve from SGLT2 inhibitors to even wearable kidneys, integrating mental health and equitable access remains essential to patient-centered care. Let's go ahead and take a look at those first pre-test questions. Our first question is, what are the 2 most common causes of chronic kidney disease? The answer is diabetes and hypertension are the leading causes of CKD. Our second pretest question was, which medication class has shown to slow the progression of CKD and reduce cardiac and renal events? The answer is SGLT2 inhibitors such as dapagliflozin and epagliflozin, which significantly slows CKD progression. Number 3, which is one common mental health challenge that patients with chronic kidney disease frequently experience? The answer is depression is highly prevalent and reduces quality of life and treatment adherence. What is one important advocacy role nurses play in kidney disease? The answer is nurses advocate for equitable access to dialysis and transplant services and provide early detection. We thank you for sitting in with us on today's presentation on kidney disease, and we'll see you on the next one. We hope you enjoyed your time here with us today. Thank you so much. Bye-bye.